All right, so we're going to start by warming up our patient on the recumbent bike for 5 minutes. Being on the recumbent bike should reduce any pressure in the lumbar region and prevent the right hip from going into any excessive flexion, which may aggravate it. Then we're going to move into our myofascial manipulation. We're going to do the iliac crest release on the right side to release any fascial adhesions that may be contributing to that raised iliac crest on that side. We're also going to do the psoas release bilaterally and the compress and hold technique on the piriformis and glute med to target trigger points. By compressing the muscles, it spreads apart the fibers and stimulates proprioceptive input, which should reduce the muscle tone. And these techniques also decrease collagen cross-links and increase tissue lubrication by increasing the amount of ground substance in the connective tissue. We're also going to do medial to lateral stroking of the lumbar spine and side lying. And this technique should also help reduce the tone in the quadratus lumborum by stimulating proprioceptors as we spread the fibers apart. And it will also, again, decrease cross-links in the connective tissue and improve fiber glide and mobility. And then after these techniques, we're going to reassess to see if they worked.
Perfect. Thank you, RJ. So after that, we're going to go into the joint manipulation. We'll be performing the posterior rotation of the right innominate bone to reduce the anterior torsion. We will also be performing grade 3 and 4 posterior glides and lateral glides of the femoral acetabular joint on both sides. These manipulations will decrease the collagen crosslinks, improve tissue crimp, promote fiber glide, and increase the ground substance, which will all improve range of motion at the joint. We will then reassess the tissues to see what impairments are still present. If there are still fascial restrictions, we will perform the superficial elongation of the caudal trunk fascia to prepare the tissues for stretching of the anterior hip flexors. After this, we'll do the superficial long axis distraction of the connective tissue of the spine to treat the mobility of the fascia over the SI area. These techniques will lengthen the fascia through sustained tension, which will rupture the collagen restrictions and hydrate the tissue. These techniques will also affect the viscoelastic properties of the connective tissue, specifically the viscous component, which will lead to permanent tissue changes. And this increase in tissue length will improve the mobility.
So after completing the joint and myofascial elongation, we're going to be reassessing our patient, seeing how they responded to that treatment. And then we're going to be going on to the neuromuscular reeducation portion of treatment, where we're going to be doing a contract, relax, PNF stretching technique of the one joint hip flexors, which is the iliopsoas. We're going to hold these contractions for 3 seconds, or we're going to do 3 contractions for 30 seconds. And then we're going to reassess how our patient's feeling after that. We'll then move on to a plank, where we're going to be focusing on strengthening the abdominal corset and rectus abdominis. We're going to be doing this for 3 sets of 30 seconds with a 2-minute rest, followed by an isometric hip extension to support and promote that posterior rotation manipulation that we had mentioned prior, and also strengthen the weak glute max and glute med. We're going to do 10 repetitions with 10-second holds for this one throughout the day. And then we're going to be also working on some lateral stepping just to strengthen, focus on hitting that glute med. We're going to be using a red TheraBand for 3 sets of 15 feet, going both ways with a 2-minute rest in between those sets. And then we're going to be also doing some squats, focusing on having the patient place their legs with a little bit of femoral external rotation so that we strengthen the lower extremity. And then we can work on training in a pain-free range to get her back to playing tennis. We're going to be doing that for 3 sets of 10 with a 2-minute rest to see how she does. After all of these exercises are completed, we're going to communicate with our patient, see how she responded to that treatment. And then we're going to get into the postural instruction. She mentioned a new job where she has to drive a lot. So education on properly. A proper pelvic tilt is going to be important, and we're going to do so by teaching her how to engage her abdominals and her deep core to keep that pelvis in neutral, especially during the long drives and her typical daily work. Afterwards, we're going to reassess, ask her if she has any questions, and then we're going to send her home with the home exercise program. Our home exercise program is going to be focused on the isometric hip extensions, where she again is going to hold 10 repetitions with 10-second holds for with 2 minutes rest. After these reps, we're going to probably have her do it 3 times a day. And then we're going to do squats with the proper form that we taught her with the externally rotated femur to continue to strengthen and get her ready for sports. We're going to be doing 3 sets of 8 for this strengthening. And then the last 2 exercises we're going to do is we're going to be working on the lateral stepping, working on firing that glute med, getting it back to proper sequencing and firing during her day-to-day. Same thing, 3 sets of 15 feet bilaterally. And then we're also going to be doing the plank to work on her core strength for 3 sets of 30 seconds with 2-minute rest in between, focusing on that core strength and endurance. And we're going to be doing this until fatigue or compensations are present.